Around the end of March in 1832, the Hôtel Dieu Hospital in Paris suddenly began to receive a large number of patients. They had a varying range of symptoms, including fevers, chest pains, vomiting, and headaches. Most of them were dead within a day. The ensuing 6 months would be one of the worst nightmares in the history of France. The cholera epidemic, which was to claim a total of 19,000 lives, had begun. There was little to be done as cholera swept the city, but afterwards the local officials in Paris did their best to ensure that such a disaster will never happen again. As a result of government involvement, wider streets and better sewage systems were constructed. But that was not the end of cholera. Even the cities of America, protected by the Atlantic, were not immune to the destruction and death that cholera brought. When it finally struck, local governments created several boards of health. They built hospitals, quarantined the sick, and cleaned the streets. By 1866, the most organized board, the Metropolitan Board of Health, had eradicated the last of the disease from America. In developing countries like South Africa, however, government and politics play an even bigger role. Total cost recovery, the brainchild of private water companies, is the idea that ending subsidies for water will help build the country's economy. However, when it was implemented in South Africa, it contributed more to misery than to development. In poor areas where privatization exists, millions have been cut off from water simply because they cannot pay for it. The water cutoffs have forced poor people to take water from polluted rivers, contributing to some of South Africa's largest cholera outbreaks. In Haiti, a similar scene had occurred. In 2013, when cholera struck, the world came together to confront the disease. Its efforts, however, were muddled by the United Nations' apparent role in bringing cholera to Haiti. Epidemiologic evidence strongly suggested that the peacekeeping troops stationed upriver from the Latam imported a strand of Nepalese cholera to Haiti through a faulty sanitation system. Politics, it seems, has inadvertently caused the cholera disaster that killed over 7,000 Haitians and sickened over 530,000. The contingency in all these cholera outbreaks is the effort governments made to control the epidemic and to treat the sick. In Europe and America, the government took steps to quarantine the infected and clean the streets. In South Africa, during the worst of the outbreak, water tanks at tens of thousands of dollars were imported in every day. In Haiti, after the first cases of cholera were discovered, Doctors Without Borders rushed in to treat the sick and to stop the disease from spreading. However, most of the methods adopted by local governments and even the rest of the world have been largely preventative. The South African government spent hundreds of millions of dollars after the cholera outbreak to import clean water. Yet in many parts of the country, clean water was not attainable only because local governments did not take action to fix already existing water taps. In Haiti, only 12% of the population have access to purified water, and only 17% have improved sanitation, which includes only the simplest pit latrines. In order to fully eliminate cholera, governments need to take active measures to improve sanitation and sewage, and to especially take the initiative to provide people with safe and clean drinking water. Only then can the disasters brought by cholera be completely eliminated.